Hi, I'm Nicole Peters, Clinical Sales Specialist with Siemens Medical Solutions, and I'm here today to demonstrate to you the new Siemens S2000 ABVS, an automated breast volume scanner, which is going to allow you to automatically scan the entire breast using ultrasound and a 14 megahertz transducer. So, we get started. Patient lying supine on the table. What you're going to do is just determine cup size, and as you select the cup size here, it automatically optimizes the depth, gain, frequency of the transducer, and your focal zone position. Very intuitive. I'm going to have the patient roll up just slightly. That's perfect. So this is the transducer pod here. Transducer's right here. I'm going to apply some lotion to the breast for contact. I'm going to rub it in a little bit. Sorry about that. And then what we do, place the transducer pod right over the breast. Can you scoot down just a little bit? That's good, perfect. Okay. Right in the center, apply some pressure just for contact. I'm going to lock the mechanism in place and increase pressure. Is that okay? I'm going to do it again. Still good? One more time. So we introduce the pressure just for contact. It's not anything near the compression used in a mammogram, so it's comfortable. From here, we're going to choose which view we're doing. You could do different views. Typically, A, B, C cups, you do 3 views, AP, lateral, and a medial. And then larger cup sizes, you'll do a superior, inferior, and possibly an axilla. So we're going to start with an AP. So as soon as I'm ready to go, I press the acquisition button right here. The transducer scans up to the top. This allows you to watch, make sure you have good contact, increase depth if you wanted to. This is where you would do that. And then the scan takes about 60 seconds. And then we'll move on to the other views. Now, the benefit of something like this automated breast volume scanner, we have been able to reduce the time it takes to do a screening breast ultrasound basically in half, from 20 to 30 minutes to 8 to 10 minutes. The transducer again is 14 megahertz. It's about 15 centimeters wide. And as soon as it's done, the mechanism will unlock to release the pressure. And then you're able to select or reject depending on what you've seen on the screen here with your contact and things like that. So as soon as it gets to the bottom here, you'll hear it unlock, and then you can lift up. And we'll move this out of the way. We're not going to do any more acquisition, so you can go ahead and lie flat. So this is what it would look like on the screen here. You can also look at the screen on the S2000 as well. Accept or reject. As soon as we accept, oops, I'm sorry, you know what? We could put our nipple marker right on the nipple here. Accept. And then it's going to take us to our next view. So it's going to wait for all 3 views, or in your case, you probably would do a superior or inferior just because of the cup size. And then from there, you can come to the unit. If you did want to do any handheld ultrasound, if you saw something as it was scanning, you would grab your handheld ultrasound transducer here and do things like elastography, color Doppler, things like that. And then when you're done, end the exam here, sends it over to a workstation that you can use to analyze the images and put everything into a report for yourself. So after the images are acquired off the S2000, when you end the exam, sends it right over here to this single auto or ABVS workplace. And the benefit of doing the ABVS, the volume scan, is to get the coronal plane, which is displayed right here on the lower left-hand side. Now the image on the top here is what the radiologists and sonographers are used to seeing on ultrasound. But physicians, surgeons, etc., that are doing breast surgeries are most comfortable with the coronal plane down here in the left corner. So we can scroll through from the surface of the skin all the way through to the chest wall. This will help determine location of lesions. You can measure the distance from the surface of the skin, the distance from the nipple, as well as the depth of the area that you're looking at. So I'm going to choose my crosshairs right over this area, and as you can see, it syncs up every image to that specific lesion. From here, you can mark that lesion, put it into a report package, use some BI-RAD settings to determine what type of shape it has, characteristics, anechoic, hypoechoic, things like that, and then put it into a report package, like so. If I could do it. Here we go. The physician can then put any extra notes that he or she may want, and then print the report either to a paper printer, send it to a PACS system, or put it on a thumb drive, DVD, CD, things like that. So that's the benefit of the coronal plane being able to see from the surface of the skin all the way to the chest wall. And this is nice, you're getting a volume of information, so you'll have all the information needed to make your diagnosis as opposed to what is sent to you, static images from the system itself.